Greetings to all my friends and students. In this video, I will talk about radiation sickness, its clinical features and management. Now, what is radiation sickness? Radiation sickness occurs due to harmful effects produced by exposure to ionizing radiation used for diagnosis and therapy. And sometimes it may be accidental exposure to radiations. Large doses of radiations cause immediate effects on the body, whereas long-term exposure to low doses causes genetic harm. Radiation injury is irreversible and hence the results may be lethal. However, there are some drugs that can help removing the radioactive elements from the tissues. Radiation sickness was first described after Hiroshima and Nagasaki nuclear bombing. It may occur in patients who are exposed to low-dose radiations for cancer treatment, exposure to high doses caused by atomic weapons or from power plants like Chernobyl malfunction case can cause lethal damage. According to the onset of symptoms, radiation sickness is divided into two categories: acute radiation sickness and delayed radiation sickness. There are some conditions required for acute radiation sickness, which are as follows. Number one condition is the radiation dose must be large, that is greater than 0.7 gray or 70 rads. Gray and rads are the units to measure the amount of energy absorbed by the human tissue due to radiation. Doses as low as 0.3 gray or 30 rads may cause mild symptoms. Number two condition is the source of radiation must be outside of the patient's body. Third condition is the radiation must be penetrating to be able to reach the internal organs. X-rays, gamma rays and neutrons, which are high energy radiations, can penetrate deep inside the body. Fourth condition is that a significant proportion of the body or entire body must have exposed to radiations. The last condition is that exposure to radiations should be delivered in a short time. Now, coming to the clinical features and signs and symptoms caused by the exposure of radiations. In mild cases of acute radiation syndrome, nausea, vomiting, diarrhea, anorexia, headache, malaise, and rapid heartbeat may occur. The symptoms usually subsides within 24 to 72 hours. In severe acute radiation syndrome, the symptoms usually appear in these stages. Prodromal stage, which lasts for a few minutes to few days, marked by nausea, vomiting and diarrhea. Latent stage, which may last from few hours to few weeks. In this stage, the patient becomes symptom-free. Manifest illness stage, which is marked by specific symptoms related to circulatory system, nervous system, gastrointestinal system and hematopoietic tissue. Fourth stage may be recovery or death, which may occur within few days to months or years. The specific symptoms may be related to cardiovascular or central nervous system, gastrointestinal system and hematopoietic system. Cardiovascular or central nervous system sickness occur when the total body dose of radiation is greater than 3000 rads. This type is the most fatal and the prognosis is poor. It is marked by nausea, vomiting in the prodromal stage, along with anxiety, confusion and loss of consciousness within few hours, followed by tremors and convulsions within 24 hours, leading to coma and death within 3 days. Gastrointestinal sickness occur when the total dose of radiation is 400 or more. It is characterized by nausea, vomiting, diarrhea, resulting in severe electrolyte imbalance and severe dehydration, hypovolemia, circulatory collapse, septicemia, and organ failure. Hematopoietic sickness or bone marrow sickness occur when the total dose of radiation is between 200 to 1000 rads, marked by anorexia, fever, malaise, nausea, vomiting in the prodromal stage, It is followed by a latent period. The hematopoietic tissue begin to atrophy, leading to pancytopenia over a period of days to weeks. Pancytopenia, which is lack of all types of blood components, results in anemia, reduced immunity, and hemorrhagic tendency. The delayed effects of radiation include a number of signs and symptoms, including absence of menstruation or amenorrhea marked by infertility, anemia, leukopenia, and thrombocytopenia due to pancytopenia or bone marrow failure. There are multiple skin disorders such as skin redness or erythema, atrophy or sometimes thickness of the skin, which is called keratosis, and sometimes skin cancer may occur. Cataracts, loss of hair or alopecia, vascular changes in the skin called telangiectasia, chronic progressive renal failure due to long-term exposure to radiations leading to anemia and hypertension, painful myopathy with atrophy and calcification, pericarditis and myocarditis in cases of radiations given to mediastinal tumors. Myelopathy may occur following intensive therapy of abdominal lymph nodes for abdominal tumors. Alterations of the genes in proliferating cells of the body and germ cell may occur, and the number of mutation is increased in the exposed cells, and this can cause genetic defects in the offsprings when inherited. Now, how to clinically diagnose and manage the acute radiation or chronic radiation sickness. Close monitoring of exposed patients using Geiger counters or whole body counters, urine analysis for non-gamma emitting radionuclides, radon breath analysis in cases of suspected radium ingestion. Treatment includes copious rinsing with water and special solutions containing an agent such as EDTA that binds many radioactive isotopes in cases of skin contamination by radioactive material. Rinsing and debridement are necessary until the affected area is free of radioactivity. Ingested material should be removed immediately by gastric lavage. In cases of radioiodine inhalation or ingestion, potassium iodide should be administered to thyroid uptake, and diuresis should be encouraged. Neupogen was approved in 2015 to treat myelosuppression caused by radiations in adults and pediatric patients. Prussian blue is a pigment approved by the FDA for the treatment of radioactive cesium and non-radioactive thallium exposures. This pigment traps these elements in the intestine, rendering them non-absorbable, and expel them out of the body in the stool. Calcium DTPA and zinc DTPA are also FDA approved drugs that speed up the excretion of some radioactive materials from the body. Finally, the symptomatic and supportive treatment is required for the cardiovascular and central nervous system sickness. Management of shock, oxygen therapy, pain, anxiety, and convulsions controlled by strong sedatives in severe cases. For gastrointestinal sickness, the therapy will be acquired according to the severity of the symptoms. Antiemetics, a bland diet, fluid electrolytes, and plasma may be required according to the clinical condition of the affected individual. Antibiotics, blood transfusion, and platelet transfusions are recommended to treat pancytopenia caused by bone marrow failure. Simultaneous use of cytotoxic chemotherapy or use of immunosuppressive drugs should be avoided. Surgical excision and repair are required for radiation-induced skin ulcers and cancer. Hormone supplementation for sterility or for ovarian and testicular dysfunction is used, but the results are controversial. This was the brief discussion about radiation sickness. Thank you so much for listening. If you like the video, make sure to drop a like. Let me know if you have any suggestions in the comments below.